Hi, I'm Ashley, and this video is for BSN-225. I will be demonstrating how to instill the Opthalmic eye drops for my patient. Before I enter the room, I'm going to verify the order from the provider and that I have the right dose that I'm getting ready for the right patient and that this is the right time. He's receiving it twice a day, so I have confirmed it is the right time, the right dose. We're doing 0.25% of the timolol eye drops, and he will get 1 drop in each eye. I'm going to enter the patient's room, wash my hands when I go in. I'm going to close the curtain and provide for patient privacy and then introduce myself. Hi, Mr. Smith. I'm Ashley. I'm going to be your nurse today. Can you confirm your name and date of birth for me? Perfect. I verified that with his wristband, and that is correct. Mr. Smith, I'm going to go ahead and place some eye drops. So these are your drops that will help reduce the pressure in your eyes for your glaucoma. We're going to do 1 drop in each eye. It might cause a little bit of burning or stinging. You might have some watery eyes or even temporary blurred vision. So that's all normal, but if any of those things persist or you're having any severe pain, then just make sure to let me know. Before I administer these, do you have any allergies to any medications? No? Any environmental allergies? No. Okay, I've also confirmed that in his chart we don't have any allergies documented. So I've washed my hands, put on clean gloves. Before we get started, I'm going to assess his eyes, and I see that there's some crust built up in his eyes. So I'm have my gloves on and a clean washcloth with warm water. I'm gonna have you close your eyes for me. And I'm starting on the inner part of the eye and working my way out. And I'm using a clean part of the rag every time I do this. Holding for just a second to moisten up any difficult spots. Okay, now that his eyes are cleaned and ready, I'm going to take my gloves off, dispose of them, wash my hands again, and put on a new set of gloves. Mr. Smith, do you have any questions? No questions. Okay, I'm going to have you lay back in a supine position for me. And once I place these, just make sure not to close your eyes too hard. You can lightly blink, but try not to put any pressure on your eyes. I'm going to hold a cotton ball under here. I'm going to gently pull, slight pressure here to open up his eye. And I'm going to have you look up for me. And again, I'm confirming this is my timolol, 0.25%. And I'm going to do 1 drop. Hold that there. Go ahead, just blink kind of lightly a few times. Make sure we're not losing any of the solution. Okay, throw this away. I'm going to get a new cotton ball and do the other side. Okay, same thing. Go ahead and look up for me. Holding light pressure. About 2 centimeters away from the eye, and I'm dropping 1 drop in the corner. Okay, again, try not to put any pressure on there, but you can lightly blink. Okay. All right, Mr. Smith, do you have any questions? No questions. Okay, make sure to let me know if you're having any side effects. Like I said, just a reminder, a little bit of burning, itchiness, temporary blurred vision is going to be normal, but if it persists or you're having any kind of pain, anything that concerns you, just hit your call light and I'll be back in to check on you. I'm also going to document this in the chart. So I have documented that for Mr. Smith, we gave his timolol ordered by the provider. It was given at the right time via the Opthalmic route as it was ordered, 1 drop. I will be documenting the route of administration and the time that I administered it, as well as any adverse effects that he has or any complications during the procedure, which there were none. Before I leave, I'm going to clean up, empty my things into the trash, wash my hands, make sure my patient is comfortable.